In a world where maternal and infant mortality rates remain alarmingly high, with millions of lives at stake, the World Health Organization issues a sobering reminder. Nigeria ranks second globally in estimated maternal deaths, with one of Africa's highest neonatal mortality rates. In Adamawa State, Governor Ahmed Umaru Fintiri stands resolute, confronting the formidable challenge of enhancing healthcare for the most vulnerable.
My assessment is that we are doing our best. This is a world-class mother and child center that you can find anywhere in the world. And in our effort to ensure we reduce the maternal and child mortality rate in the state, we find it expedient to ensure that we have this center in the state so that our people will continue to benefit from the effort of government. This project was started by Governor Nyaku, but in our effort to ensuring that continuity is sustained in the state, we have completed it, and you can see to yourself that everything that is required of world-class standard is here.
Health officials provide insights into the strides made in healthcare under Governor Fintiri's leadership. Notably, the newly equipped Obstetrics and Gynecology Center, catapulting Adamawa into a new era of healthcare service delivery for mothers and children.
A lot of things were done to ensure that these facilities are properly equipped so that our people will have a lease of life when they visit these facilities, to be able to have good medical care. Aside that too, His Excellency employed nurses, midwives, he employs some medical doctors, and he encouraged the health sector by placing their salary at par with that of the federal institutions, because the salaries the health workers in federal establishments are enjoying now the same salary that His Excellency implemented in Adamawa State. That was what informed so many of our medical officers to come back to the state with the intention to work for the state. And that is kudos to, we can say kudos to His Excellency for that.
We are in Adamawa State Specialist Hospital, specifically Department of Obstetrics and Gynecology, and this is a new unit for that department. This department serves for the women and children, pregnant women and children that are born newly. This department is a world-class standard department of obstetrics and gynecology, and it will serve the entire people of Adamawa State with a state-of-art facility in obstetrics and gynecology. It also will serve as special baby care unit for children that are born with jaundice or some disabilities.
Maternal mortality and child mortality actually goes a long way talking about what is required actually to minimize or to reduce the burden of diseases and then the problems that relates to pregnant women and children. Now for this particular structure, I've gone around and I've seen a lot of equipments that are here, and so it's actually a state of the art, just like I said earlier on, ranging from where the women will be seen when they come in here in labor. We have the first stage room, the second stage room, and then the postnatal ward, and each of these wards are actually equipped with the state of the art equipment and things you need to monitor women in labor. And of course, like we are talking about reducing maternal mortality, you know, effective management of labor is very, very key in reducing maternal mortality. So some of the things that are available here, we have CTG, we have monitors inside the labor room, and we also have ultrasound scan that you can use to even scan a woman when she comes in immediately. And then it will help you in making diagnosis in some instances. And of course, the postnatal ward too, they are well equipped. We also have a functioning theater with electrosurgical unit, the operating table, anesthetic machine, and all the things that you will need in theater to offer services in a tertiary institution. I can say we have it all here. So going by the equipments we have here in this facility, it will go a long way to actually aid the services that the staff will provide in this facility.
This project has been ongoing for more than 10 to 12 years, and we approach His Excellency. And he also gave the approval that these people be paid so that they can complete their job. We came also, there were dialysis machines that were lying in the store. We wrote to His Excellency, we need to install these machines. As long as they remain in one place, their softwares get spoiled and we have problems with it. And thank God, he gave approval still. And he released the funds. And we are trying to put it right so that our people will enjoy the facility.
In Adamawa State, there's no machine we don't have. This is just one department. And in this department, we have every machine you can think of in obstetric and gynecological ward, both for the babies, for the mothers, and even for other subspecialties that may be required in the process of managing a pregnant woman. Here we have all facilities, like in terms of radiology, we have an emergency ultrasound scan, we have ECG, we have X-ray machine, we have a cardiotopography machine, we have two twin theater, world-class standard for surgeries, where two surgeries can be done at the same time. We have a modern CSSD, where you can autoclave your instrument without even seeing them. Some of the facilities used for this autoclave is actually using ultrasound for sterilization, and they are all here.
There are challenges actually when it comes to tackling the issue of maternal mortality in our own society. Talking about maternal mortality, it's actually a broad subject that doesn't restrict itself to just the facility where services are being rendered. It has to do with the woman that is pregnant, even before she gets pregnant, after she gets pregnant, coming for antenatal, and then delivery process, postnatal. So problems in each of these phases of life of the woman during her reproductive age can actually increase maternal mortality. So reduction in maternal mortality as it relates to this place, and then tackling challenges, we have to look at the problems that exist and how to tackle them. Well, we are talking about this center in particular. So talking about this center, whenever a patient comes in, definitely, the patient will definitely be let into this facility. So the process from getting the patient from the gate down to this facility or to this place, it's actually very important so that a lot of delays along the line can be eliminated. Okay, this is a woman in labor or having an emergency that needs prompt attention. So those delays can be eliminated, and then once she's here, prompt attention can be given. And once that is given, it will go a long way in reducing maternal mortality. And then the things we need for monitoring, we have them. But very important to mention here is the personnel. You will have equipment, you have facility. If you don't have personnel to make use of those equipments, it's equal as not having those equipments. Because these people will not come and deliver on their own. We need experts to actually attend to them in labor. This is ranging from the midwives that are skilled, and also obstetrician and other health workers that will assist in making sure that whenever a woman comes in, what is needed to be done should be put in place to ensure that she delivers safely, so that we'll have a healthy mother and a healthy baby at the end of the day with minimal problems. And that will help a long way in reducing maternal mortality.
He made pronouncement concerning women and children, 5 years to 1 day. And he has made it clear that he wants this kind of groups to have a lot of intervention. And I can also tell you that, like I was talking about counterparts, people are being captured now in the health agencies. And one of the things His Excellency did was to pay the counterpart funding also for capitation of our people, so that people have access to health facilities. And people should know that also they need to move to be registered. When you have that, government is subsidizing health costs. So already the government is subsidizing by paying capital fire funding. So this, when people come in there where you are supposed to pay, let's say 100,000, government has paid even 75,000, because there are agencies too that are also intervening to subsidize the cost of health. So government has put in its money, donor agencies have put in their money. And so when people go there, that is why we are calling on people to register, to go to ASHMA, register, Adamawa State Contributory Health Agency. Once they are captured, when they go to these facilities, and like I said earlier on, if it costs 100,000 or 200,000, it will be subsidized, because already government are taken off some percentage of what they are supposed to pay. Of course, there are vulnerable groups that also His Excellency is considering to ensure that because of their situation, they access these facilities free. So that is what government is doing. But of course, we want people also to show responsibility. Now is Fintiri, this is what he's doing. Okay, if he gets out of here and things change, how do you manage yourself? So government through Contributory Health Management Agency has subsidized a lot for indigents in Adamawa State.
The contribution of the governor of Adamawa State has immensely changed the landscape of healthcare in Adamawa State. Look at 2 years ago, we opened healthcare facilities in Shelen, in Gombe, in Song, and now we're going to open another one in Fufure, in Lamurde, in Demsa, and you can see even the equipment for these health centers are on ground. So you can see that he's working to make sure that healthcare is not a problem for the citizens of Adamawa. So the public is going to benefit from these services, and they no longer have to travel far away to even get treated for diseases that were thought to be a disaster in the past.
As Governor Fintiri leads the charge, let us join hands in support of this noble cause. For every mother, for every newborn, for the future of Adamawa State. Together, we can make a difference. And this is the size of our package this week. Join us again next week for a fresh episode. Until then, bye for now.
Muna nan